Hello, everyone. Thank you for being here on this somewhat dreary, rainy, gross Saturday. If you are in the Raleigh area with us. Um, but yeah, thank you for taking some time out of your weekend to come and listen to Dr. Samantha Hoover with Rainbow Embrace Physical Therapy. She's going to talk a little bit about her practice, inclusive care, and how physical therapy can help you in your life. So, without further ado, Dr. Sammy.
Thanks, Corey. And thank you all for coming, and thank you to the LGBT Center of Raleigh for letting me do this chat. So today we're just going to talk a little bit about what physical therapy is, what Rainbow Embrace is, and why physical therapy can be important to your life. So my name is Dr. Samantha Hoover. I'm the owner and operator of Rainbow Embrace Physical Therapy, your specialist in inclusive and informed care. And there should be a Q&A box, so if you have any questions throughout, please feel free to ask. I'm just gonna do a few slides and then I'm happy to answer as many questions as folks have. So here's some of my contact information. I'll make sure to show this again at the end. But you can find me on Instagram, Twitter, and Facebook. And I also host a podcast called Everything Under the Rainbow, all about lifting LGBTQIA plus voices and businesses. So feel free to check that out. So a little bit about me. I am a graduate of the Medical University of South Carolina with a doctorate in physical therapy. It was kind of a long road that got me there. I started out in music, and while I was getting my degree, I went into personal training and was doing some mixed martial arts training and some amateur sparring and stuff like that, and ended up hurting myself and got physical therapy, and that kind of led me down that road. And as well as also in personal training, most of the time when I had folks that had lost some function, and I was able to use movement to help them get that back, that was the most rewarding to me. So that kind of pushed me into physical therapy. And more recently, in the last like 10 years, I came out as bi and got more and more public about who I am, and was realizing the health disparities that we all face. I've had really bad experiences in the medical setting. And I know that can be worse for folks who are trans or gender expansive. So I created my business to try to offset some of that, and also to try and educate other healthcare providers on not only different anatomies, but just different lifestyles, because there's really just not a lot of education out there. So that's kind of what I'm doing now. I'm also active in my professional association, the American Physical Therapy Association, and I'm the head of the webinar task force for PT Proud, which, if you go to their website, ptproud.org, you can find a list of inclusive physical therapists. In case maybe I'm not licensed in your state or you're looking for physical therapy somewhere, they're wonderful. And I'm a bisexual, cisgender white woman and an ally and advocate to the trans community, as well as everyone in the LGBT community. And so, what is physical therapy? A lot of times, ever since I opened my practice, I'll have people reach out looking for mental health therapy, and I'll usually point them in the direction that they need to go to find someone inclusive for their mental health. But physical therapy is for your entire body. So this is including your skin, your musculoskeletal system, which so that's your bones, your joints, your tendons, your muscles, and your neurological system. So everything within your spine and in your brain. So it could be anything from having a sprained ankle and needing some pain relief and getting that function back. Or it could be something where you had a serious brain injury from a car accident or something like that. You could come to physical therapy as a part of your recovery for those things. And so, according to the APTA, physical therapists are movement experts who improve quality of life through prescribed exercise, hands-on care, and patient education. You can find out more about physical therapy in this session, but also at choosept.com, which is the APTA's advocacy site for choosing PT first over some other treatments that you can have that might be more costly and have some side effects that aren't always so great. So I always try to push PT first before anything with my family and friends. If you suddenly have some shoulder pain, or if you've been experiencing chronic pain for a long time, a lot of times physical therapy can be the solution to that when other things may not have worked, or when or before you go out and try those other things. So in our country, opioid medications are very overprescribed for everything. So there's definitely an epidemic in our country with that because we prescribe those right away. And a lot of times the first line of care, and according to the CDC, the first line of care should be physical therapy before we go for surgery or any kind of opioid medication. As some of you may know, opioids are highly addictive. They can be very expensive over time. Physical therapy, often you only need 5 to 7 sessions before you're feeling like you can manage the pain on your own and improve on your own. So it's often cheaper to go to PT. And if you go and get surgery before you get PT, you're probably going to need to come to get physical therapy anyways. So I always recommend with any kind of pain that you try PT first. So yeah, and you can learn more about those CDC guidelines here. But for most conditions, you won't need surgery or opioid medication. So here's some success stories. I've got a few videos, so I'm going to go ahead and switch over and play some of those. Just make sure everyone can hear.
I have torn my right meniscus, torn meniscus in my left knee, rotator cuff in my left shoulder, and the big one, spinal stenosis between L4, L5 lower lumbar. When my back was taken away from me, then I could barely run. The leg just stopped working. The physical therapist bought into what I was trying to do, run. He knew what was going on. He tweaked my running style. It's allowing me to resume normal life activities. I want to be accepted as normal. I don't want to display the one thing I can't do, and that's see. And sitting still just wasn't it for me. Now I have spring in my step. I feel much better because of who and what I am and the physical therapist.
When the explosions happened and my leg was gone, my biggest thing was, number one, staying alive. I mean, I really did think that that was it for me. I thought that my quality of life would be a zero. Mustering up the gut to be able to actually do it and feel my limitations was so tough. It was more mental than physical. My physical therapist completely understood that and knew that I needed the mental capacity to be able to do it, and she just kept my eye on the prize. Physical therapy means everything to me. You know, my physical therapist taught me how to walk again, and that taught my family and people around me that I was physically able to do anything that I put my mind to.
The patients that I mostly see in my classes and in my practice have had pain for a long time. Chronic pain, persistent pain, back pain, neck pain, knee pain. Many of them have already had surgeries for total knee replacements, total hip replacements, and they're looking for a safe way to continue exercise. Many people come to the practice of yoga not really knowing what it's about, but they've heard that it's good for them therapeutically. And so being a yoga physical therapist, they realize that it's going to be a safe practice for them to go to with pain. If you're in a state of chronic stress, your healing time is not going to be as effective, and some of the chemicals that are coursing through your body actually delay the process of healing. So what yoga can do is create the right environment for you to heal by decreasing that stress response, getting you into the parasympathetic nervous system, that part of the nervous system that'll let you kind of downplay all the chronic stress and create an environment for healing.
Alrighty, so that's just some success stories with PT and different ways that PT can present. So it could be something like yoga, or it could be manual therapy techniques, or training someone on how to walk again after an accident like Adrienne experienced. So PT can come in many forms, and it can treat a variety of symptoms and issues. So here are some other things that PT can treat. So just acute pain, if you maybe fell on your shoulder and now it's hurting, you can come to PT and we can get you fixed up. So chronic pain, something that's been happening for 6 or more months and nothing is really seeming to help. A lot of times when folks come to PT, we are able to find solutions that help them get their function and quality of life back. We do wound care, so that can be something like having a pressure sore, and we can treat that skin, or after surgical care, we can also treat the incisions in that area where the surgery took place. Cardiac rehabilitation. So this is if someone has had a cardiac or a heart attack, some kind of event, we can help folks get back to where they were through endurance activities that are heavily monitored to make sure that everyone is safe. Because after you've had an event like that, that can be scary. So PT is involved in stuff like that as well. We're also really good for preventative care. I harp on this all the time to anyone who's going through pregnancy. During, before, and after, PT is very important. You're pushing a very large thing out of a very small space. So it's good to come to PT so we can help get your hips back to where they were after the pregnancy, and also prepare your body for that with strength and flexibility and all of those things that you need for an event like that. And then also for sports, so any kind of football or anything at all, you can come to PT to prevent some of the common injuries. So in football, a lot of ACL tears. So if you come to PT, we can do all the activities and agility exercises that you need to try to prevent that from happening. And they're actually starting to incorporate PTs in the NFL now for that purpose. And then pelvic health. So this is one that's not widely heard of. This was initially called women's health physical therapy, but now the APTA has changed it to pelvic health because It's not just for women at all. So it's everything related to your pelvis. So it could be pain during sex, pain during toileting, or just pain there for no reason and you're not sure why. It could be, again, for pre or postpartum care, or it could be pre and post gender affirming care. That's everything involving PTs. It's lots of education and hands-on care and strengthening of your pelvic floor muscles. And that is something that I specialize in my practice for the LGBTQIA community specifically. Also, we can do joint pain, back pain, neck pain, muscle aches, some neurological disorders. So if someone's had a stroke, we're heavily incorporated into that rehabilitation process, or a TBI, a traumatic brain injury. Parkinson's, there's lots of things that we treat in the neurological realm. We also do balance therapy as well as treatment for vertigo. And for both of those things, oftentimes you don't need any other kind of care, like any other kind of medication, if you come to PT first, or it can be used in congruence with medication and other kinds of treatments. Also for lymphedema and rehabilitation effects of cancer and cancer treatment. So my husband actually passed away from cancer a couple years ago, and he actually, the occupational therapist was, which goes hand in hand with PT, was instrumental in finding out that he was experiencing some delirium in the ICU. All of the other doctors didn't notice that, but PTs and OTs, we spend a lot of time with our patients. So so we're often good for those things too. And you know, the treatment effects of cancer are devastating to the rest of your body, and it takes a long time to rehabilitate from that. So PT can help with that. We can help get folks back to where they were pre-cancer treatment. And then as far as gender affirming care goes, this could be pain from bracing. So sometimes if you're having trouble breathing, or if just sitting up straight is hurting, or it's just hurting around your rib area, that could be from bracing. And it could be anything from just us finding a brace that's better suited for your body, or just doing some exercises to get you to a point where things are not hurting you or making it harder for you to sit up, just making sure everything's fitting right and that you're strengthened and stretched in the right areas. Same thing with tucking. There can be pelvic pain, pain with urination, pain with intercourse from tucking. And that can also be different techniques of tucking to help with that. And also pelvic floor strengthening, again, to help with some of the pain that might come from, may or may not come from tucking. And then pre and post operative care. So any bottom surgeries, top surgeries, any surgical care at all, PT is very good, both beforehand to get everything strong, and so that surgery recovery lasts a little bit, like a shorter time frame, and then afterwards too, to help you rehabilitate. So PT is instrumental in these things. And the reason that I created my practice is because a lot of times from my friends and family in the trans and gender expansive communities, they don't feel comfortable in the medical setting and don't feel comfortable going to PT one to 3 times a week with someone who might be misgendering or dead naming, or even if it's not that, just not having the knowledge on the things that they need to have knowledge on. So my practice is specifically for the LGBT community, so that you can come and seek therapy and feel like you're with an educated professional. So, and then some of the healthcare inequities affecting the LGBT plus community. I'm sure folks listening right now know a lot about these, so I won't talk about this for too long, but right now in the US, the decision was overturned and we no longer are protected. Doctors and providers, healthcare providers, are allowed to turn LGBT folks away just due to their belief systems. And that's another reason why I created my practice, because I think that that's appalling. And I'm hoping to help other medical providers understand why that's not okay. But then also folks that just don't have the education that they need to be able to be a good healthcare provider for everyone. And then there are studies showing that folks in the LGBT community often just don't seek care because they're afraid of discrimination. So again, I'm trying to create a safe space in my clinic, but I'm also trying to assist other providers to create that safe space as well. And I don't know about you all, but I've had bad experiences in the medical community myself. So I'm trying to be one of the ones that doesn't give those negative experiences. It should feel safe when you go to see the doctor or go to see your PT. So again, I specifically focus on the LGBTQIA+ community. I'm a part of the community myself, and I do consider myself an advocate. Again, working with PT Proud, I work on the webinar task force to try and educate other just physical therapists on terminology and anatomy and just on how to be a better provider for everyone and getting away from that cis hetero norm that we're all kind of stuck in. I am a virtual practice right now. I'm hoping that after the pandemic, I'll be able to do some home visits as well. But right now I'm a virtual practice, so I can see folks across the US. There are some states that I can't get licensed in just because we get licensed in individual states, and we have a PT compact that I'm a part of. So almost half of the states, it's just a click away for me to be licensed, and I can go ahead and treat people across the country from their own home. You don't have to leave your house. And I also have sought out specific education in LGBTQIA+ topics, and more specifically in trans pelvic health care. And I do take a trauma-informed, kink-aware, and inclusive approach. I think with pelvic health PT especially, there's lots of different things that can happen and lots of different lifestyles, and I want to make sure that everyone feels comfortable coming to see me so that they can get back to their life comfortably and pain-free. So the reason that I love telehealth so much, it was initially because of the pandemic, but one of the best things is that it creates a lot of independence for my patients very quickly. I used to be a very hands-on PT, and I think I still would be if I could get my hands on folks with the pandemic going on and everything. But so now I use more of an exercise related approach and showing folks how to do their own manual therapy techniques so that they can just start doing that and you don't have to see me as much. So that makes it a little bit cheaper, and it also just gives folks more confidence in themselves because they're able to but do their own treatment when they're not with me. So when you come to see me, I just kind of add on to your treatment plan and we go from there. It's also very safe right now for a variety of reasons. That you don't have to leave your home. It's all on the computer. Convenient, so no driving hours and hours away to go and find a provider that you know is going to be safe and inclusive. You can just open your laptop up. And flexibility, because it's telehealth and I don't have to go anywhere either. I'm able to do this on lunch breaks, in the evenings, early mornings. I see folks on the weekend sometimes. So it just makes it a lot easier overall. There's some times when someone will come in and I feel, okay, well, this person needs to be seen in person, and then I'll refer out. But I would say like 95% of the time, I'm able to go ahead and treat folks just from the computer. It's pretty great. So it's also affordable. I did go ahead and start a sliding scale. My goal is to make this into a nonprofit eventually, so that I can also see folks free of charge, so that there's accessible care for everyone. But right now, based on your household income, you will get a reduced rate if you're worried about being able to pay. So it is affordable care. And again, I don't feel like you have to see me quite as often. I do try to make everyone as independent as I possibly can. So less frequency and less paying for PT. I also have inclusive intake paperwork. And this is something I've tried to educate other healthcare providers on doing as well. Because in the case that because it is very hard to get a legal name change if you haven't had that done yet, we want to be able to have that legal name so that nothing with insurance paperwork gets messed up. But then I also don't want you to ever be dead named by me. And it's just me in my clinic, but if I had any staff or anyone in my staff. So I try to get it into the system right away so that I know pronouns and names and everything. And then I also know all of the legal formalities that I need for insurance paperwork and all of that as well. So I try to make sure that my intake paperwork is also very inclusive and doesn't make people feel not great right away when they walk in the door. The intake paperwork doesn't even include their gender. So you shouldn't have to deal with misgendering and dead naming anywhere, but especially not at a medical appointment. So that's my goal. So here are some resources. You can always go to ptproud.org and rainbowembrace.com /resources, which I'm going to go ahead and show you that website now, just to show you some of the other things I offer outside of PT, just some free resources for folks. And then also Choose PT, that's the APTA's website advocating for making use of PT. So I'm going to go ahead and take you on over to Rainbow Embrace. Just one moment. So this is my website here. I just launched a mentor-mentee program for folks in the LGBT community. These buttons here just go to surveys, so I can screen people and just make sure everyone's being kind and it's not trolling or anything like that. But just for folks who are possibly just coming out or transitioning or whatever the case may be, who want support from someone in the community and may not have it nearby. So just a way to connect people in the LGBT community to one another. And then I try to update this list every couple of weeks, but this goes from anywhere from finding any kind of healthcare provider to also knowing your rights as someone in the LGBT community, knowing how to do name changes, ID card changes, gender marker changes, stuff like that. That's all found here. I just recently updated it to also have some spiritual things as well. I'm not a super spiritual person, but just churches that are safe for those of you that are. Drug rehab facilities, Facebook groups that I found to be inclusive and helpful, doulas for folks going through pregnancy, and also I think there's end-of-life doulas and stuff like that, but just all inclusive. And these are just ones that I found. Most of them are folks that I've spoke to and I feel good about, but some of these are just things that I've found being in the community. So nothing I can really vouch for, but I try to update it so that we have lots and lots of resources for the community. And then can always go and check out the podcast here. This is another way to get some good resources, but it's called Everything Under the Rainbow. And each episode I interview a different person in the LGBTQIA+ community, and they will tell me about their life, just kind of whatever they want to talk about. Most folks have businesses or nonprofits that they're promoting, but it's also just to chat about being in the LGBT community and kind of normalizing that, and to push resources out into the community as well. And that's really all that I had for you all today. I just wanted to kind of explain what PT is, what I do. I know that's much shorter than the time we had, but I did want to kind of make this short so I'm not boring folks. And I wanted to leave lots of time for questions, which I'm going to do now. So if you have any questions at all, feel free to ask. And also, if you do not happen to be in North Carolina, or again, if you're looking for any kind of healthcare providers and you need help finding someone that's going to be inclusive, please feel free to throw that in the chat box too, because I do try to help folks with that kind of stuff. So I just got a question from Corey here. So the states that I'm licensed in right now are North Carolina, Texas, and Virginia. And let me actually pull up a map. I can show you where I can quickly be licensed in as well. Give me just one moment here. So this is our PT Compact map. Any of the states in dark blue are states that I literally just have to go on and buy a compact privilege, and then I'm licensed to treat. So it's like a 24-hour turnaround or less. And then those states in white are ones that have not introduced legislation. We're just trying to get a national licensure for physical therapists, but on our way there, but not quite there yet. So these states that are dark blue, I can get licensed in really quickly. These ones I can still get licensed in, but it takes some time to do that. And then the light blue are states that have been introduced legislation, but they're not giving out compact privileges yet. So that's what I was referring to when I was talking about that. But yeah, right now, North Carolina, Texas, and Virginia. So just got a question from Corey. Do you only do individual care, or do I offer group sessions of any sort? So with physical therapy, you can't do group sessions. I do only individual care, but I do, as I said, I have a background in personal training. So I do offer group exercise programs on occasion. and by request. So, but otherwise I do individual physical therapy only. Yeah. Any other questions for me so far? Alrighty, I'll give you all a few minutes. But yeah, please feel free to ask questions. I do offer, as well as that sliding scale, I also offer treatment packages that come at a bit of a discount too. So if you have any questions about that or questions about more of what physical therapy can do and what we can treat, anything at all.
If no one else has any other questions or anything that they, want to talk about, we won't keep you for too much longer. And I know that there was a slide up with Dr. Samantha's contact information. I don't know if you want to put that back up just so people can jot that down. This has been recorded. And so we will be sharing it on a couple different platforms. So if there's folks that were not able to be here today that might find this helpful, please share it with them. And again, if there's any questions or anything, there's a phone number, an email, website information. The podcast, which I didn't know you did. That's pretty cool. Maybe people will be really interested in checking that out as well. So yeah, awesome.
Thank you, Corey, and thank you everyone that attended. I hope you learned a little bit more about PT, and if you were too nervous to ask a question now, please feel free to email me or shoot me a text at that number or call. Always available.
So thank you again for everybody taking their time out of today. I think at least over here the sun is coming out, so maybe we can enjoy a little bit of the rest of the day. But thank you, Samantha. That was really informative and great, and I hope that people really got something out of it. So yeah, thanks everyone.
Appreciate it. You all have a good day. I'm glad the sun's coming out too. It was hailing over here earlier.
Oh gosh, yeah, it was. It started snowing a little bit, so
Yeah.
It's wild North Carolina, that's for sure.
Mm-hmm.
All right, thanks everyone.
Alrighty. Bye, Corey. Thank you so much again.